Hi, everybody. You are listening to another episode of Living with Lyme, and we are going to have a very cool interview with Dr. Michael Lovich. He is a doctor of chiropractic. He's also specializes in sports medicine. I encourage you to look on the website for his very impressive biography. Today, we're going to capture the importance of some issues that go along with neurology and healing from neurologic issues. I want to welcome Dr. Michael. How are you?
I'm doing well. Thanks for having me.
This is great. Very unique and a very different approach to healing. Your company's name is Delta S Performance. And until just before our interview, I thought the S was for sports. So that was wrong. Tell us where that name came from.
So Delta S is the second law of thermodynamics. And what that means is something called entropy. What entropy is it means that all things in the universe go towards a state of disorder or dysregulation. And you need to put energy into the system in order to create order or to create regulation. My freshman year chemistry teacher gave this awesome analogy that I've been using ever since. Think of it as a messy room. If you just live your life day after day, your room will get messy. There's nothing you can do if you just come in and live in and out of it. However, if you spend the time and you spend the energy, then you can put order and functionality into that room.
I get it. Messy rooms were always an issue with my kids, and I learned very early to pick my battles, so I just shut their door.
Right? That's one thing. If you shut the door, then you don't see it. And I used Delta S because I thought it was a great analogy for healthcare. And so what the idea is, if you don't actively take steps towards improving your health, it will get worse. That's just how physics works. That's just how life works. But that should empower patients and empower you to each day try to make decisions that will improve your health. A lot of people do like the shut the door approach and don't think about it. And then sooner or later, that room gets messier and messier. Then you get a little minor explosion. And you're like, okay, how do we clean this up now?
That's perfect. That's a great analogy. Now, you're specializing in functional neurology. And so I don't think many people are aware of that. And in fact, before I met you, I wasn't at all. So let's dig into that. What is that and where do we use it?
So I'm going to try and piggyback off the concept that most people are familiar with, functional medicine. So the difference between regular medicine and functional medicine is that we're not just trying to classify things into a diagnosis and then based on the name diagnosis provide a series of treatments that will then say, okay, well, you had diagnosis X, you get treatment A, B, or C. When one of them doesn't work, we try the next one. The idea behind functional medicine is to do all the same examination, to do all the same detailed thinking, but then say, how well is it working? Not just, okay, this is broken, this is not, these numbers say these values and we call it this. How does it work in a living system? And in reality, most of the patients that have complaints or not complaints, but concerns are going to be like headache, dizziness, fatigue, just not feeling right, little things that are just not quite right. And what that ends up being is not necessarily a problem or pathology, but pathophysiology. Your body's physiology just isn't working as well as it could, and you're getting symptoms from it. However, in a regular system, your body is still working within normal limits. So if you take that whole functional medicine approach, which is primarily physiology related, and is going to be a lot of approaches, a lot of the treatments look like gut approaches. But then you think, what about the brain? The brain has its own immune system. The brain has is a completely separate nervous system than the gut. The brain is just as deep and complex as the gut, except it's separate to it, but also works together with it in a gut-brain axis. And so where I feel it gets even more complicated is because not only are you looking at it from a pathway and physiological perspective, like hormones and nutrients and all that stuff and neurotransmitters, but you also have to look at it from the perspective of a structural and functional organ that you can use a physical exam to figure out how it works. So that's what functional neurology is. We're not just trying to test the brain to figure out is it working or not working, but how well is it working and how can we improve brain function to get it to work better for patients and reduce symptoms.
How did you come about learning and finding this incredible path?
So I was in chiropractic school and I was diagnosed with ADHD when I was a kid. And when I was in chiropractic school doing about 36 credits a quarter.
A week? That would have been impressive.
That would have been ridiculous. No, but
that would have been crazy.
36 credits a quarter. And what ended up happening was I realized that my medication wasn't working the same day to day. It depended on how much I slept, what I ate, and then I still had other symptoms, but the medication was just for the focus piece, and that focus piece, when medicated, created its own other group of symptoms that I then had to deal with there. And when you're working that hard and studying that much, you don't really have time to deal with the symptoms. You need to be able to function at a high level. So I started learning I was in fifth quarter, and I started learning about this stuff called functional neurology, and I went to a class called Mastering Brain Chemistry, and I started learning more and more about how the brain worked, and I found a program called the Carrick Institute, which teaches clinical neuroscience or functional neurology. And I noticed there was a guy who taught for them local to where I was going to school in Portland, Oregon, Glenn Zielinski. I was like, all right, let's see. He says he works with ADHD. Let's see if this works. I'll go in. Worst comes to worst, he takes my insurance. No harm, no foul. I went in there. I had a more thorough physical exam done than ever done by any other doctor. And not only that, he also put all the puzzle pieces together and started asking questions that I didn't even realize were related. And so once I started learning this stuff, I was like, I can't not know this. Now that I know it's out there, now I know whenever I'm working with a patient, I'm going to feel like something's missing unless I'm testing all of these things.
That's amazing. So we want to know what happened.
What happened?
Yeah, you got all this testing done and...
We just did some brain rehab.
Yeah.
So we know what exercise is. So for example, if you follow my thumb from here all the way over here, we know that's called a pursuit. We have a good idea of where in the brain that's activated. And we know which areas of the brain may not be activated or less activated. And so through a series of exercises that were targeting parts of the brain that were found on examination just to be less active or less in balance, my symptoms started normalizing. My overall brain function got better. Posture changed. Focus changed. I didn't need to take medication anymore. And this wasn't a nutritional approach. Because a nutrient, you can't take a supplement and say, hey, I'm going to take this supplement and it's going to only make this bicep bigger.
I'd like to see that.
Right. Wouldn't that be awesome? That's called a magic bullet. And unfortunately, magic doesn't really work in medicine. So the idea is when you're using a nutritional approach, that can support a system that can help make sure that there's enough oxygen and glucose getting into the neuron so the neuron can function. But how do you activate that neuron in the way that's most appropriate for the patient?
So we see that it helped when it came down to ADHD. Where else do we find this way that you're treating people? Where else can it help?
So the way I usually explain to patients is if the brain has a hand in the function, most likely it can help that. Now, we're not going to make claims like we're treating or curing anything that is pathological and honestly can't be treated or cured. However, if you're talking about your brain's overall functionality and your brain is needed to figure out where you are in space, where the world is around you, so you can map out those worlds so that way you can appropriately navigate the world around you and respond to challenges or threats that come your way. Think about it like this. If you got up and you walked over the couch behind you, but you weren't mapping out the world and you walked into the couch, would that create some sort of painful stimulus? Would that create some sort of mismatch in your brain? And then psychologically, you're going to start saying, wait, what happened there? I'm confused. And then start getting some sort of psychological symptoms associated with that. That's the basis of what we do. And so so my clinic, Delta S Performance, we have offices in Boston, we have offices in Providence and Denver, Colorado. We work primarily with concussions because in reality, they're relatively straightforward and simple using this approach, and we see really good results.
So let me stop you there. So post-concussion syndrome can be extremely severe, and
Right.
people can lose memory, they can lose time at work, school, personalities can change, ability to focus can change. So let's walk through this first. Someone comes to you, is referred to you because they're having difficulty. Say they had a concussion maybe a month ago. Your technique, you're going to do a full neurologic exam.
Mm-hmm.
And then you're going to find wherever there is some issue, and then you're going to tell us what you're going to do.
We're going to rehabilitate those areas. I had a parent of one of my patients come in and say, well, as he was watching the examination, he said, wow, it's like you're doing a bedside MRI of the brain. Because each of our tests, as we go through our cranial nerve exam, through our peripheral nerve exam, through our station gait and coordination exam, and through our ancillary studies that we do, we are mapping out all the different areas of the brain to the best of our ability using objective measures, not just, hey, does it feel all right? Oh, what are your symptoms? Describe them to me. Because, here, I'm going to ask you a question. What is a concussion?
What? What was the question?
What is a concussion?
A concussion is trauma of the head that causes your brain to bounce in and out of, well, not out of your head, but back and forth. So it's coup and counter coup. Am I close?
Right. So that's how it happens. But what
is it? Well, I look at it as some form of tissue damage and injury to the communication between all different parts, because your brain communicates with movement, with digestion, with smell, taste, hearing.
So wouldn't it make sense that if you have an issue with communication, that you would want to increase the communication by making it communicate more in specific ways that are shown in an examination to have a deficit?
Well, I guess so. That sounds actually very good.
Then why do we just stick with the nutritional approach?
Well, I think you're funny. You're trying to back me in the corner here. So listen to me. I think that there are many ways to help people with all kinds of diagnoses. I think your care is so specialized, I didn't even really know about it. So my goal is to try to optimize health. You're smiling and you got the Cheshire Cat smile going on over there. But mine is to optimize people's cellular health. So we're looking at all of the things that happen with the mitochondria, every cell in the body, and providing it with what it can do. We do have issues with the blood-brain barrier and getting everything up into the brain. And we know that the brain is full of fat. So we have to make sure we're nourishing it. So your exam is very hands-on, but isn't there also sort of machinery kind of stuff that goes along with it?
So there's machinery. So before we talk about the machinery and all that stuff, I'd like to come back to my question.
Oh, you're so fresh. All right, go ahead.
No, I don't want, for the listeners, I don't want them to be like, okay, well, what's up with that? So
Okay, that's fair.
to keep everything simple, your neurons need three things to be healthy: oxygen, glucose, and activation. Mitochondrial health is part of that: glucose mechanism, nutrient absorption, and oxygen metabolism. All the other things that functional medicine is so great with are all super important and are really useful in this as well. And the idea is we just want to have a thorough opinion. We want to get enough data and do enough of an examination so we can actually have the right to an opinion, as opposed to, okay, you've got a concussion, which you were spot on. A concussion is a communication issue. At the cellular level, it's an inflammatory response in areas where the brain has been stretched. So let's talk about this. So in the brain, let's see if we got something I can use as an example. Nope, no tissues around here. So I usually use a tissue to explain this, but if you think of this as the brainstem and this as the rest of the brain, when you have some sort of trauma to the head, which doesn't always create a concussion, but if you have some sort of trauma to the head and you get this moving around of this soft gelatinous brain of yours, where is most of the shear forces and the tensile or stretching forces going to be?
In that center, yeah.
Deeper areas. Those are all your regulation areas. Your deep cortical, your deep brain centers are all there and are all associated with a lot of subconscious reflexes that help you react to things in life without having to think about them. Imagine if you were walking and every single time your body moved up and down while walking, your frontal lobes had to come in and control and interpret everything for your brain. How tiring would that be? What happens to a brain that gets tired? It starts to revert to more, let's say, behaviors that are lower on the evolutionary chain. So we're going to talk about more emotionality, more anger, irritability. When you start to look at all of these subjective findings, you can correlate them to an area of the brain. And sometimes it just comes down to activating that area in a sustainable way, which involves the nutrition and the diet like you were talking about. But it also involves, how do we get into that one area that is associated with this, as opposed to just doing a general whole brain approach. And that's where these very specific exercises come in. And what the exercises look like are like vision rehab and vestibular rehab and proprioceptive or physical rehab. But the idea is we're not looking at it from hey, your shoulder isn't moving, so we're going to get your shoulder moving again. We're looking at it from how is this all integrating in the brain? And the complexity of that is fascinating. Like, you can read forever on this stuff. And for example, what is the cerebellum for?
Balance.
Right. Do you know that only approximately 30% of the cerebellum goes to balance?
No, but now I do.
Yep. About 70% of the cerebellum actually goes towards emotional regulation and mood.
Oh, really?
Yeah.
See, my mom, when she always wanted to give you a boof in the back of the head, maybe that's what happened to me.
Maybe. I mean, it's hard to say back then. But it's not necessarily due to trauma. It's more, the less you use it, the less activation it gets, the less it grows and develops. That's why just any exercise that's within a threshold, of course, can be useful for improving concussions and post-concussion syndrome. However, in our office, we monitor our patients so that we make sure that that they stay underneath that threshold, but we get them to that threshold as much as possible. And then think about it like this: if you're going to learn how to run a marathon, you can't just hop off the couch and run it. You got to go 1 mile, then you go 2 miles, then you go 3 miles. When it comes to the brain, it's harder to perceive that fatigue level. So that's why we're there to do it for patients and to make sure that we're doing measured advancements and keep them having the best experience as they get better, as opposed to, hey, here's your protocol, go do this. We work within a framework with our patients so it can be individualized.
So other than your hands-on technique of examining someone, is there some sort of calibration that you do via some sort of machinery is kind of what I wanted to ask you.
So we have, so we can use goggles, put goggles on a person's face with infrared cameras, and you can see eye movements, and you can measure those eye movements. You'll hear it often called video nystagmography, or VNG for short. So what a VNG does is it measures all conceivable eye movements, like back and forth, up, down, jumping from side to side, and some reflexes, like with moving backgrounds, and then it puts numbers to it and compares it to normal data.
You wiggle me around with things moving, and you better get a bucket.
Right. So that means there might be something to improve. And then we also use balance testing. So the idea is, does balance testing by itself measure a concussion? No. Balance testing measures your ability to balance. It'll measure your ability to balance with your eyes open or eyes closed, or your head in different positions. And as a physician, we can isolate those and say, okay, maybe there's a little more of your left anterior canal that's associated, or your right posterior canal that's associated. Maybe it's more of an up and down thing than a rotational thing. But we can measure all that stuff, and combined with a neurological exam, the bedside examination, then it provides really good data. But the tests by themselves do have their limitations, and I find in clinic that only use those tests without using the knowledge behind the tests that they miss things. And when you miss something, when you're dealing with a puzzle as complex as a concussion, the only person that suffers is the patient, because that means their treatment takes longer. So that's why we try to pride ourselves on being thorough and comprehensive. And that's the most important thing for us, is the examination that we can do with patients.
So, let's talk a little bit about the Lyme brain, because we know that is a significant issue for several people with Lyme disease. And we know that, from our functional standpoint, we really feel that it is not necessarily spirochetes in the brain, although it can be there. They can go just about anywhere. We talk a lot about inflammation and things that are created in other parts of our body. You're releasing a cascade of inflammatory markers. You're smiling again. What did I say?
I have comments.
Comments, go ahead.
So one thing I'd like your listeners to understand is that inflammation is not bad. There are some functional...
It's not always bad.
Right. And inflammation is just a finding. It's not bad until it creates a problem. So there are some functional medicine educational bodies out there that are teaching that inflammation is the root of all disease. But you know what inflammation causes?
Well, inflammation is necessary for when there's an injury.
You know what else inflammation is necessary to create? Memories.
Ah.
There are a bunch of functions in the brain that require your pro-inflammatory markers to be there. And you need a balance of pro and anti-inflammatory markers in order for it actually to work. So when patients get this fear in their head of, wow, I have inflammation in my brain, or I have inflammation in my gut, or inflammation in my cells, now I need to do all of these anti-inflammatory approaches, that might not be the most appropriate thing. There are some chronic pain pathways that are activated by having excessively low inflammation in that area.
Say that again.
There are some chronic pain pathways.
Pain pathways, okay.
That fire when your neurons are hyperpolarized, and that could be associated with too little inflammation.
So let's stop there. If you have too little inflammation, and we're always, yes, we're always interested in down regulating inflammation. How do you help your body, and how do you know which one it is?
That's the question. So maybe the question we should be asking isn't how do we figure out if there's too much or too little inflammation, but more which system that's associated with producing those pro or anti-inflammatory cytokines isn't functioning as well as it could be. A very common one is homocysteine in your glutathione systems. You can see certain markers on physical exam and in laboratory work that will say, hey, maybe this system needs some help. Or here's a fun one. So there's something called the neuroimmune complex. Basically, every time one neuron connects to another neuron in something called a synapse, there's either 1, 2, or 3 individual immune cells that cover that synapse and help modulate the functionality of that synapse. So help tweak and alter it, calibrate it so that way it's most appropriate. This is called it's called a tripartite or a tetrapartite or a pentapartite synapse. So the idea is, how do we regulate the immune system, not how do we shut off the immune system? And the immune system is so important. And when you're talking about Lyme or Lyme Brain and that kind of stuff, I mean, so when you get bit by a tick, you can get Borrelia burgdorferi, you can get any number of co-infections, and no one says that one tick is only allowed to carry one infection. But the idea is, if you get the infection, you still have to take care of the infection. What's the most common way to take care of the infection?
You're going to tell me antibiotics.
Right. It's the most common way, and usually it's high-dose antibiotics. There's a guy down in Connecticut who does that and is relatively effective with high-dose antibiotics. But what else do antibiotics do?
Oh, it ruins your microbiome, and then there's a gut-brain connection there, and so
there's also a connection that starts in the brain. You don't even have to deal with the gut yet.
Okay,
so
tell us.
The microbiome, and oh yes, microbiome is everything, but also it causes degeneration of your vestibular system, the inner ear that measures balance.
And is that why a lot of people have ringing in their ears after a tremendous amount of antibiotics?
Yes. There's a paper by Bisht and Bisht called Ototoxicity, the Hidden Menace. And you can get that paper. I believe it's free online. And you can look at the symptoms, and you can look at the medications that are associated with ototoxicity and creating those symptoms.
I know, but it's the worst of two evils. You know what I mean?
Right. No, I'm not saying don't do it.
No, it's good to know where it comes from, but you know, it's hard. It's hard when people are like, oh, you know, I've been chronically ill. That's why I think that there is a really good, it's a really good decision to do herbal approaches. You know, I have to say that Dr. Stephen Buhner's herbal approaches have been very effective. Now, he's done research. I've talked to a lot of practitioners, and they are, you know, very, very pro for this. I'm just wondering how effective they would be when you've got a severe neurologic issue, especially like with children.
Mm-hmm. It gets a lot more complicated. And we find in our clinic, by the time the patients reach us, because we're literally Dr. 9 to like 19, by the time patients find us, they've been so entrenched in this world, exactly how you've explained it, which is not wrong. It is very 100% correct. But we'll find that the complexity of the brain also depends on a lot of other factors. And so where I was going with that ototoxicity thing is, so we know that the cerebellum regulates mood and emotionality. The vestibular system fires into very similar areas. So if you have decreased vestibular information coming in, a lot of these vague neurological conditions, like changes in mood, chronic fatigue, dysautonomia.
Tell people what dysautonomia is.
Right. So dysautonomia is when you're unable to regulate your autonomics, your parasympathetic and sympathetic system. And every time that I see a patient or I see a post on Facebook about, here are 10 ways to increase your vagus nerve, I have rarely found people needing to increase their vagus nerve. You know why? Because we do an exam. We don't just associate it with subjective complaints like, oh, I have stress today. So the idea is, what if it's not that your sympathetics are firing too high and your parasympathetics are firing too low? What if it's that in the balance, because you have so many regulatory factors that when one gets too high, it's going to pump the other one up to balance it out. When one gets too low, they're both going to balance out. What if we're not looking at an issue with too much sympathetic, but we're looking at too much swinging back and forth instead of being regulated right in the middle tightly? What areas of the brain regulate those systems? Instead of, this isn't a mood thing, and this isn't a subjective experience thing, that comes secondary to this area of the brain. It's called the brainstem. Your vestibular system fires directly into your brainstem. Your cerebellum fires directly into your brainstem. We can use those parts of the brain to fine-tune and calibrate those areas of the brainstem to help regulate a lot of these systems. Now, it does get more complicated when there is an active infection going on. We have that active infection does need to be taken care of. But at the end, but afterwards, we need to come in and we need to rehabilitate that brain. We need to rebuild those connections and those pathways so that way those deep reflexes that we were talking about earlier on today are back involved and are able to do things on their own. Because there's an interesting paper I read that was talking about patients who use a mindfulness approach, how if they are really following that like live, laugh, love mindfulness approach where they are deep breathing and they're doing all these de-stressing exercises. Exactly. What happens is the minute they stop doing it, they're more stressed. They are swinging themselves back and forth instead of using brain out. Instead of top down, frontal lobe down to create mind body, we should be using deep brain out to create these reflexes so that way you're able to handle things subconsciously without having to worry about it. Wouldn't that be easier?
I don't know. It sounds more difficult to me. You know, that's part of the problem. People wanting something now and not having to really put a lot of focus and time into it. It's easier for some people because people are, you know, going at a mile a minute. And you really sounds like you have to slow down, especially if you've got something neurologic. You know, people who have illness, whatever it is, the brain seems to be the first place people seem to have symptoms. I don't, you know, I mean, even if you break your leg and you have pain in your leg, it, you know, after a while, it grates on you and you have mood changes, and it all comes back to the neurological components of our brain. Is that how you see it as well?
That's 100% correct. Actually, last week, and I was in Dallas teaching a class or co-teaching a class on pain science. And we were talking about how this is a fun question that we were asking all of the people who were there. Is there pain that you cannot feel?
Well, the first thing that comes to mind is phantom pain. I know that that's a little different because you do feel that pain, even though the leg or the limb is not there. So the question is there pain you don't feel? I'm going to say yes. And that's my final answer.
All right. So the idea is that you can't have pain that you don't feel because it comes down to your frontal lobe's interpretation of the perception of something called nociception. Nociception is the physiological gunk that happens when you get an injury. And that will create a stimulus response that goes to the brain. But think about it like this. And this is an example Glenn Zielinski always uses, is if you're doing martial arts and you get a kick to the face, how much does that hurt?
Ow.
How much does it hurt when you get a paper cut?
Ow.
Which one usually hurts more?
I don't know. I'm going to say that paper cut, for goodness
Yeah, that
sakes.
paper cut's going to ruin your day, especially if it's one of those cardboard ones. Those suck.
Ooh.
And so the idea is pain is still a perception of the brain, and it's an interpretation of the sensory information coming in.
Well, you think about a paper cut and it's on your finger.
Mm-hmm.
And I'm sure that getting kicked in the face, in the head, I'm just wondering, nerve-wise, it has something to do with the amount of nerves that are in our fingers?
Versus your face,
No?
there's a lot more in your face.
Okay, so I wanted to clear that issue.
Oculus, like the huge hands, the tongue, the nose, the eyes are big. A lot more sensory information coming in right here.
Yeah. So that's tough. What are your thoughts on the cause of that brain fog? No matter what's going on in your body, and people are complaining about this fogginess and this memory issue and forgetfulness. I know that that's a very generalized question, but can you just think of somebody who you've worked with that has had these complaints, and how, are we going to be able to improve these things?
Right. So brain fog, and I'm going to also throw in chronic fatigue with that.
Yeah.
So we're going to take this away from a psychological component for the moment. We're going to talk about it from a physiological component. Chronic fatigue, brain fog. Now, have you ever worked with anybody who has super low-level dizziness?
Yes.
Does that dizziness present as they're spinning or lightheaded, or does dizziness present as just they're sluggish and slow, like they're just kind of off, brain fog?
Yeah, I think more of a spinny thing.
I've had patients who have come in because when we exacerbated it doing provocative testing in the office, it turned into dizziness. But when it was resting, or at its like baseline tone, it was presenting and described as brain fog. Another thing. So remember we talked about mapping out the world around you? So using your eyes to figure out where the world is around you. Your brain uses sensory information to sort of get a pulse on itself, to make sure everything's all right. Using your eyes to look at a target allows you to map out the world around you easily. So one of the things we measure in our office is called gaze stability, your ability to look at a target and keep your eyes on that target. You'll notice, like if I said, hey, look at my thumb right here and keep your eyes on it, you'll notice that most people, when you do this in office, are going to have little micro eye movements. Not even the head moving, just little micro eye movements. Every time your eyes jump, which is called a saccade, so jump from one area to another, that space in between the two targets, because your eyes are moving so fast, your brain has to shut off, because every time you move your eyes, which direction does the world move? The opposite direction, right?
Opposite, yeah.
So imagine if you picked up the world moving that fast every time your eyes jump from one target to another. That would ruin your day. So now there's this thing in the literature called the Wtf response.
Oh, I know what that stands for.
Right. So when you're jumping from target to target, in that zone, your brain actually shuts off for just a hypersecond, for a very small sliver of time. But when your brain shuts off, it's going to increase sympathetic activity because it's creating this, hey, I don't know where I am right now moment. Every time you blink, it can happen too. So I'm not saying don't blink, but you need to work on other systems if you get some sort of stressful experience from little eye movements that aren't an issue. But imagine if every time you jumped your eyes from target to target, you weren't accurate, and you had to reposition your eyes to reach that target. That means you're doing twice the work every time you move your eyes. How many times do you think you move your eyes throughout the day?
Oh, I have no idea.
So we have found by improving the reflexes that go between the inner ear and the eyes and the neck and the inner ear, a lot of our patients with these vague complaints have seen improvement. We combine it with a functional medicine nutritional approach as well, because a lot of times we need to help those neurons exercise more, and we need to modulate that inflammation or control that inflammation so that way we can exercise them more. But
well, I'm confused. I'm confused only because I asked about that level of memory and functionality and being kind of like walking around like you've taken way too much Benadryl. And then you talked about the ear and the eye. So I'm losing the connection there.
Okay, so here's a connection. When you're talking about these subjective complaints of memory is a temporal lobe function, right? And then your frontal lobe is working memory. Your parietal lobe is going to be describing how vivid the memory is. Your occipital lobe is going to deal with some other parts of the memory, and especially right over here, you're just feeling like you're moving through mud and just feeling like you're off. If we break that down into the parts of the brain that are associated with creating that feeling, it is an energy level issue, which can be related to what we just talked about, doing excessive work because your brain is working harder than it needs to. It can be an issue with interpretation from your inner ear. Because imagine if you were walking everywhere and your body was getting misinformation saying that when you were going forward, you were doing one of these. That miscommunication in the brain will become this vague interpretation of, hey, things are off. Hey, I'm just tired all the time. That kind of stuff.
That's kind of amazing, because I'm thinking there's so many things that can help with. I mean, your day-to-day ability to function in the world. And it's so hampered, yes, by nutrition, but by the level of stress, by the level of fatigue. Sleep is so critical. And about 100% of everyone dealing with Lyme disease has some sort of a sleep deprivation, because they wake up, they're exhausted, they muddle through. And then just when you think, oh, good, I'll be able to sleep, they get wired and tired. And we know that's that sympathetic kind of fight or flight, and having a difficult time to get into that parasympathetic portion so that we can rest and digest. But it seems like everybody could benefit.
And that's the idea. We've noticed with a lot of our patients that walk into our doors that sometimes it's a little more complex than that, and we need to use a team approach. But a lot of the times, just our home exercise that we give will create just enough of an improvement for people to realize that this is part of the issue. Now, in the office, we're able to improve functionality as we see it. We get to test, and then we get to try a therapy, and then we get to retest right away and see if it changed how we think it's going to, and we can wiggle our way towards the most appropriate therapy. But what ends up happening is that because these chronic Lyme and tick-borne illness conditions are so complicated, we have very slow progress. And that comes back to that delta S thing. Every day you got to work in the right direction and just keep on chugging along slow and steady. Within our office, because that fatigue issue is a huge thing, we want to make sure that your brain is not being pushed farther than it can handle. A lot of times you'll work with somebody who will have a movement-based approach, and they will say, okay, just keep doing 10 reps. But they're not looking to see at rep 7, did your one pupil start to go in and out slowly? Did your face change? Not like stroke drooping, but you'll see slight changes. You'll see all of these signs of neurological functioning, because this is a physical human person in front of us, not just a receptacle for pills. So it's good to be able to have this in-person approach. And that's why at our clinic, we only do rehab with the doctors, because we want somebody with a doctor level education to be able to monitor this and see this and notice things.
That's amazing. That's really amazing. what about when there is damage? When people have cancer, when people have tick-borne illness, there is an increased risk for clotting. And what if have a stroke and that area of the brain is damaged? And it's, we know it's like a heart attack in the brain. You've lost that area portion of the brain. Is there a way to kind of skirt that and help people function?
Yeah. So cancer, I'm not able to comment on because that is outside of my scope.
No, it's
However,
just the blood clot thing. We know that your ability to clot and have a blood clot is higher once you've had a diagnosis of cancer. Trust me, I know that one.
sure, I'm going to let you take point on that.
I'll take
Let's
it.
talk about stroke and stroke rehab. What do people do for stroke rehab? They create some sort of activation in that area to improve functionality. So here's what happens. The neurons in the area that were killed never come back. But the neurons around that area that are still viable can be exercised and take control and can compensate for that area. So have you ever heard of like mixed dominance with eyes? How you have some people who are right side dominant, some people who are left side dominant. And if you are right-sided dominant, but you cover your right eye, you can become left-sided dominant because those neurons are used more, it will grow more, and then they start mixing together. Now, I wouldn't recommend people do that because the brain functions better when one side has a dominant side. So I wouldn't start saying, oh, I need to go make sure I'm mixed dominant. That is not a good way to biohack. However, if you are working with a stroke patient, or if I'm working with a stroke patient, we're going to not only say, how do we create activation in that area, but how do we modulate that activation? Because now we're talking about maybe, let's say 20% of the neurons in a given area were damaged. Now you're working at 80% capacity. That means when you have a thought, when you think a thought, that thought, which would have had 100 neurons to disperse its energy through, now is funneling those neurons into 80%. When you have someone do a motion, or during stroke rehab, if you are pushing beyond that, if you're pushing them into that 80%, what if that is more activation than those 80% neurons can handle? That's why it's so important to be able to look for signs and changes, not just say, here's your program, go do your program. So when we work with stroke patients, it's a very slow process, but I have worked with patients and we have seen good results with that.
That's amazing. What type of time frame are we talking? Are we talking months to work with someone, year to work with someone?
I would be safe and call it months to years.
Okay.
For talking about a stroke rehab patient.
Right.
Or any sort of ablative or post-surgical procedure, I would say that to be safe. Now, if it's a concussion, a straightforward concussion without any chronic infection or some sort of complicating factor, I would call that weeks, 1 to 2 weeks. We usually see 50 to 70% improvement in 2 weeks.
That's amazing. And you think about it with competitive sports.
Right.
We're seeing the children younger and younger. In fact, there's this big push for little ones up till high school, I believe, to do flag football instead of regular competitive tackle football.
I'm a fan. There's no reason to train their ability to take a hit until they have some mass to take the hit with. Right?
Right, because especially, you always get those mammoth boys when they're, juniors, and then you've got these little scrawny, poor young boys. You can't do it.
Right. And the idea is when I work, so I do a sideline medical. So I work a lot with Ultimate Frisbee in the Boston area, where I'll just be the trainer on the sidelines, so to speak. And one of the things that I say is any concussion can be your last. Your first one to your last one. They could all have the potential to be your last. You want to train your body to excel at a sport, train your body to excel at the sport, but the sport doesn't entail taking a hit. This sport shouldn't entail the unfortunate parts of the sport. So, I mean, I wouldn't personally let my kids play football, but It's probably because we're more of a baseball family growing up. Like my brother, but the idea is you have to understand the risk, and you can't just think that this isn't a big deal, because a concussion is a big deal. This can change your life. This can change your personality. This can change your ability to work later on. This can change your life. And one of the biggest dilemmas, and I was talking with a group of my colleagues this morning about a hockey player who has had 7 concussions. He's 19. He's being recruited for juniors. And and they're like, what do we tell this kid? Because he has a shot of making it, but he could have a financial gain from making it and playing pro hockey. And how awesome would that be? But he can also have a financial loss of, it's not even a scholarship thing. He can have a financial loss of he is unable to work or hold a job that may make as much money in the future because he was trying to chase his pipe dream, which is like, 1% people actually make it pro.
That's a very difficult thing to have to make a decision for, because again, the trauma, I mean, you need your head.
You need your head. More important than that, you need your brain. You need your brain working, because your brain's going to last a lot longer than you're going to be playing that sport.
Exactly. And we really need to keep it healthy on a variety of levels. Let me ask you a little bit about helping the brain to rest.
Mm-hmm.
We're always busy. We're always, trying to get that little extra done. Maybe we stay up a little later. And outside of sleep and nutrition to help our brain, our environment, trying to be very conscientious about the toxins that we are around or we ingest, how can we help our brain to rest?
First thing is put the phone down. It's that easy. The second thing is get horizontal. There are books and books that you can read about really high functioning people who they have nap time every day, or they have reading time every day. Think about reading. Reading is combining your cognitive abilities and your frontal lobe with eye movements. It's an exercise that is training your eyes, right? Think about people who are really high functioning, you take those naps, getting horizontal, shutting off, allowing your brain to actually clear out. Here's another thing that's actually fun. So I gave a presentation on sleep, on the intersection of sleep, mood, and focus. And one of the things that we found is when you are actually going to sleep, what makes you tired? Is it all the psychological perspectives of, oh, you've had a long day? Actually, no. Why do some people get tired or some people get invigorated during certain exercises? What makes you tired is an accumulation of metabolites. Those inflammatory cytokines are part of those. So reducing that inflammatory load, or what I like to say is modulating it so it's more appropriate, can help with that. Getting horizontal and actually taking like a 20-minute nap is how your brain tends to clear that out. That may give you a little bit of boost for the rest of the night. Now, if you're one of those people that have trouble falling asleep, you don't want to take a nap during the afternoon and then be up all night, then take a downer to put you to sleep, and then you don't have restful sleep and you get this little cycle going on and so on and so forth. We want to be as simple as possible in our approach, even if the knowledge and how we get to that approach was a very complex process. We want to be as simple as possible. Let's make it easy. Take a nap if you can. Get horizontal, even if you're not actually sleeping. Read a book that doesn't have a backlit screen. So
paper. I tell people paper. Stay off the Kindle. Stay off your phone. Stay off your computer. At least a few hours before you go to bed. Shut it down.
Yeah, and it's not even like this magical thing of, oh no, screens keep you awake or blue light keeps you awake. There's a cellular process that happens. Blue light, so light can travel through your cells. Every cell has a translucent property to it. So if you have light traveling through your eye, yes, you're going to perceive that light, but it also goes through the hole that your optic nerve comes through and goes right to the front of the brainstem, the top of the brainstem, which we've already talked about a couple times. which is how blue light stimulus can create those dysautonomias, or that sympathetic tone.
Wow.
So
Yeah.
what it comes down to is give yourself some slack, shut it off, because you'll
Yeah.
be more productive afterwards if you give yourself a break.
That's really good knowledge, and it certainly is a piece of advice that I think everybody on every level should take. You know, we know that when we push ourselves too much, there is certainly a consequence for that.
Yeah. And
I,
I'm a planner. I don't always stick to the plan, but I'm a planner, and it allows me to be cognizant of how much stuff I have going on in one day, how much stuff is on my plate, because sometimes we feel as people that we can do that too. But sometimes we can't do that. We don't realize it until afterwards. So planning out your day, waking up in the morning and just making a list of, these are the things that I have to do. These are the things that I might want to do, but I can do tomorrow. So that way you get all the stuff that you need to do done. You start working on the stuff that you want to work on, but then you can always procrastinate and push it off if something immediate comes on now, and then you're like, okay, A, now you don't have to remember everything for tomorrow, and B, you now have some sort of control over the time scale of your day.
I got it. That's great advice. I want to thank you for coming on and telling us all this very critical and useful information for a variety of people who probably didn't know that this type of rehabilitation was available.
Yeah. If
Yeah.
people have more questions for us, we have so our office in Boston. If you go to our website, deltasperformance.com, so it's Delta, S as in Sam, performance.com. Right at the top, there's a little thing that says new patient. Click here. It just brings you to an info form. We don't have front desk staff. We want doctor-patient communication to have as little barriers as possible. So we handle all the communications and scheduling, but it helps us control our schedule a little bit better and modulate how much we do in that day. If you just fill out that form, send us a question, we're more than happy to answer it.
Now, if you're in Denver, tell us who's in your other offices that we would be communicating with.
Yeah, so Denver and Boulder, I'm out here. Then we also have Dr. Krafasi, who specializes in concussion rehabilitation and is handling a lot of the Lyme cases. And then we also have Dr. Sickle, who is currently training in neurodevelopmental disorders like autism spectrum disorder and ADHD. They both are cross-trained and able to handle any patients that may come their way. But they do have their additional specialties just for that little bit of knowledge. But the three of us all talk about all our cases together because it takes a village sometimes.
It takes a village. Yes, that's what I say all the time. Thank you very much. It's been, like I said, very informative.
Yeah, of course. Thank you for having me.
Yeah. So just hold on there so I can sign off. For everybody who has been listening, this is a wonderful episode with Dr. Mike Lovich from Delta S Performance. I encourage you all to subscribe to the website so you'll stay connected, www.livingwithlyme.us. You can also visit me at www.pursuewellness.us. Everybody make it a great day. All right. Don't bang your heads. Bye.